Athletes and non-athletes have to know that every injury that we get throughout life starts to loosen or compromise joint spaces and ligaments. That compromised area that you created just collects year by year. And so you get looser and looser joint spaces, creating more and more tendency for that surface to be eroded or inflamed. We call that arthritis. And arthritis is accumulative. It doesn't happen right away. But you can stop that degenerative cascade or that degenerative pathway by introducing regenerative treatments like prolotherapy or PRP. For the sake of simplicity, and to describe an injury to any joint in the body, which includes all the spinal segments, so your vertebrae have joints in between them. They have the disc, but they also have the articulation joints, and around every joint is a capsule or something to hold it in place to keep it stable. As soon as the stability is compromised, those pads that are between the joint space start to create friction, and they're gliding inappropriately, and that's when the body tries to clamp down on it. And so it utilizes the muscles around it to clamp and hold it in place. That splinting or spasm of the muscles is many times what creates the pain. The regenerative injection techniques utilized in prolotherapy and PRP therapy will actually heal that area of connective tissue to regenerate stability back into the joint space again. So this is why I've seen miraculous results with, say, people with neck problems where they have radiation pain down the arm. If I look at the MRI, your neck is not curved anymore, it's actually straight. And so each hole where the nerve comes through is pinched because of this straightness, or I call it the architecture of the neck has changed. And the reason is that those little joint segments are torn, and the muscles try and splint to correct that, and they straighten the neck, and therefore you start having that pinching feeling because of the muscle tension. So the miraculous results I'm talking about is that if I treat somebody with PRP or prolotherapy and just touch the joints that have that capsule around it, they're minutely torn, and we start the healing right away, the muscles are signaled through the brain action, and those muscles will then relax almost instantly. And then the person feels better. So I tell them, it's not healed yet. You have a long way to go still, several months, but you're seeing results because the muscles are no longer splinting. This is just a way to really permanently and rapidly heal a connective tissue injury to stabilize the joint space.